My name is Dr. Laurel Proulx. I'm a clinical assistant professor at Baylor University in the United States. I'm a Department of Defense funded researcher studying how chronic pelvic pain affects women in the military. And my work primarily centers around better understanding how extrapelvic impairments impact the pelvic floor, and therefore how extrapelvic interventions also impact the pelvic floor. The title of our workshop is Beyond the Pelvis, Non-Invasive Conservative Care for Chronic Pelvic Pain, Bridging Evidence, Clinical Practice, and Access-Friendly Strategies. The goal of this workshop is really to empower clinicians to better understand the evidence behind some of our newer up-and-coming extrapelvic interventions such as dry needling, neuromodulation, modern pain neuroscience education, even orthopedic manual therapy, and exercise as a graded exposure. And this is to improve access to pain-relieving treatments where there may be a geographic limitation, a difference in belief system, an age limitation, or just trauma-informed care, to have strategies that complement our internal toolkit. This also helps those higher-performing athletes, women with more physical jobs with load carriage or impact that may plateau with internally focused or solely internally focused treatment. We'll also present a clinical framework that's impairment-based to make decisions on which extrapelvic or intrapelvic strategies would be best for that patient and why. This workshop addresses urgent challenges in access to specialized intrapelvic physical therapy and other conservative management options. It also addresses trauma-informed care and care progression surrounding the sole use of intrapelvic interventions. We hope to equip attendees with an impairment-based clinical decision-making framework for both extrapelvic and intrapelvic interventions, as well as help attendees better understand the state of the current research for extrapelvic interventions, whether we have established research in the chronic pelvic pain population, or if we are taking that research from other pain populations, or if there's really a lack of research that we can apply to this population. I feel like we are in an amazing time to better understand mechanism of conservative treatment for pelvic floor dysfunction due to advances in technology, imaging, and translation of interventions from other body systems. So I think that research is really in an exciting time and a lot is coming to the table. So I'm excited to learn from other disciplines and other researchers.